up choosing UVM because I loved the exercise and movement science program that they had to offer. I loved the fact that I could wake up in the morning and look at both the mountains and Lake Champlain, and I loved that I could play outside all 4 seasons.
Everyone was accepting of who you were, and I really like that about UVM.
Lo and behold, I came to Burlington and I, decided to check out UVM, and as soon as I came here, I fell in love.
What I really fell in love with was the town and the people that UVM attracts. Everyone, when you walk down the street, everyone's really happy to see you. They smile, even if you've never seen them before.
The program, Medical Laboratory Science, is amazing. I've heard great things about it, and when I visited, I fell in love.
I think what I'm most excited about working in the field of nursing is just the stories of how they've recovered and how well they're doing, like post-help.
I'm really excited about meeting all different types of people and different patients and getting to work with the patients and the families.
I'm excited about, I guess, the kids. Like I want to be able to, sit across from a kid and just help them.
I'm also really excited about helping people in any way that I can.
You can do so many things with this major, so even if you're not sure going in what exactly you want to do with nursing, there's just so many different options.
To be able to help people and offer the things that I have back to people, I'm in a good position to be able to do that.
Going to school in exercise science opens you up to a new community, and it allows you to act like yourself.
I'm most excited about the opportunities to not only help patients, but to help other students, such as myself, to excel in their careers.
You get to work with all different kinds of people, and you get to meet anyone from all over the world.
There's so much that you can do with public health to help people in the broader world.
The way CNHS teaches nursing is a holistic approach, and I feel like that is very important going into the field of nursing.
CNHS has prepared me for my career by challenging me.
I feel ready. I think the college really has prepared me to become an excellent nurse.
I really feel like just the fact that they've put us in such an intensive clinical setting has really, developed a platform for us for the future.
Every time I sit down with a patient, I really try to get to know them as a person and trying to figure out why they're there to see me today.
As a first-year student, I was a lot more shy than I am now.
My first year, I was a bit of a nerd, I would imagine. It took a while to come out of the loner phase.
I think I was pretty naive, and I didn't really know what I was getting myself into.
As a first-year student, I like to think that I was like a sponge.
I was ready to take on the world.
I think as a first-year student, I was very timid, very scared of college.
As a first year, I was a hot mess.
From freshman year, I think I'm a lot more confident in myself, and I think that I attribute that to the professors and the people that I've worked with.
I'm much more outgoing.
I'm definitely more confident, and this place feels like home now.
Much better at time management.
I'm able to have conversations with people of all identities, and I'm able to really understand disparities in the healthcare field and in the world as a much larger piece of myself.
My first day of clinicals was scary.
I was almost like a chicken running with the head cut off.
I loved it because I actually love babies and moms, and so that was one of the clinicals I was absolutely most excited for.
So I walked in the door expecting just a meeting with my preceptor, and it was a football player walks in and my preceptor's like, boom, shoulder spica right now. And I was just like, okay, let's go.
My favorite faculty member is understanding.
Patience. Determined.
Intelligent.
Eccentric.
Enthusiastic.
Invested.
Dedicated. This faculty member is always there for students.
Admirable.
Existentialist.
Enthusiastic.
Experienced.
Passionate. This professor is the most amazing professor I've ever had. Everybody should be able to take classes with him.
My advice for my fellow graduating classmates, I think would be to stay in touch.
We can use each other as like a professional resource in the future, as well as maintaining friendships that we've built.
You should just keep driving towards what you care about, because in the end, that's really what's going to make you successful.
Never stop being inspired.
I would say the most important thing is just to hold on to those people and really cherish the connections that you've made here.
You can never stop learning. That's a very important thing as you go along in medicine, because medicine never stops.
For incoming first years, I just recommend to just soak it up every moment.
Don't worry about it.
Keep an open mind.
And it's okay to be nervous.
Use UVM resources.
I also wish that I, as a first-year student, knew about frozen strawberries because they're such a good snack.
Don't let this big campus scare you.
Get involved and try as many new things as possible.
Don't be afraid to ask questions. Don't be afraid to ask for help.
Don't be afraid to admit that you don't know something and be open to learning new things all the time.
Don't drink a lot of coffee before any exams.
It's going to be hard going into the real world without like our supportive group. Yeah.
I feel like there's always someone I can go to, and I think in the real world I'll miss that go-to person or those go-to people for support.
I'll probably miss having such a close relationship with faculty that are so entrenched in the current research.
It was just such a supportive group of students, and I think we really inspired each other and gave each other the confidence to do well in school and in our careers.
I'll miss the people.
It's really having such a steady group of support is really important, and I've just been so absolutely lucky to have had that.
We are all very close, and I think that it's nice coming into Rowell and knowing you're seeing your fellow classmates.
Every time I start a new clinical experience, I actually realize I do know something, and I can't wait to put everything together.
Ever since I was little, I used to watch doctor shows on TV. You know, when I was 10 years old, my mom would walk in the room and I'd be watching an open heart surgery.
It's really done more than prepared me for my career. It's shown me everything that my career could be.
Going through the 4 years of the program, I've really found that nursing is my passion. And so being able to wake up and do something you love every day is really, really awesome.
Thank you, CNHS.
Thank you, CNHS. Thank you, CNHS. Thank you, CNHS.
Thank you, CNHS.
Thank you, CNHS.
Thank you, CNHS.
Thank you, CNHS.
Thank you, CNHS.
Thank you, CNHS.
Thank you, CNHS.
Thank you, CNHS. It's CNHS.
Thank you, 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 CNHS.
Woo!